Welcome to the Clinical Athlete Journal Club number 7. My name is Quinn Hennick, and I'm a proud clinical athlete provider. And I'm joined by Kevin McNamara, a recent physical therapy school grad, clinical athlete forum member, and the one responsible for bringing the Journal Club to life. So thanks for being here as always, Kevin.
Of course, Quinn. Thanks for having me. Looking forward to it.
It's going to be a good one. So tonight's Journal Club topic is the relationship between perfectionism and injury. And real quick, I've made a few poll questions, or a couple poll questions, to get a feel for the crew that we have tonight. So I'm going to launch the first question here. Is just demographic of, did it pop up? Oh yeah, here we go. So click one of those. Who are you? Clinician, coach, trainer, student clinician, or student coach trainer? And it looks like we've got 100% clinician tonight. Cool. And I'm going to shoot you another one, which is, do you consider yourself a perfectionist? And that's a general term. We'll dig into that term a little bit, but %67 says no. Just because you read the article, you're just saying that. Or maybe you're a perfectionist striver. So 67% no. A third of you say that you are a perfectionist. I think I would probably put myself in that category, and in my athletic career, being more of a perfectionist concerner. We'll talk about that more, I'm sure. Cool. So lastly, remember our Journal Club motto: these meetings are conducted in the sincere spirit of inquiry after truth, without fondness of dispute or desire of victory. We're all on the same team, and we're just out here trying to be less wrong. So the title of this paper that we're going to talk about is Perfectionism Predicts Injury in Junior Athletes, Preliminary Evidence from a Prospective Study. And the lead author is Daniel Madigan, and he's got a few colleagues there with him, published in the Journal of Sports Sciences in 2017. I thought this was a really interesting article. So they looked at a group of 80 junior athletes who are on the national or international level in various sports, lots of different sports, and they gave them a couple different subjective outcome measures that have to do with measuring perfectionism. And they defined perfectionism in a couple ways, but they split it up into 2 dimensions, one of which was called perfectionist striving, which is a kind of a capture of your personal standards and a self-oriented striving for perfectionism, or for perfection, as they call it. So it's like, I strive to be the best that I can, something like that. And then perfectionist they tracked injuries over the course of 10 months, and then they looked at the relationship between the injuries that they sustained and their perfectionist ratings that they had measured prospectively, and found that there was a relationship between perfectionist concerns and injury rate, but not perfectionist strivings and injury rate. And in fact, it was for every standard deviation that somebody scored into the perfectionist concerns subscale, they doubled their risk of injury. So there was also some predictive value there as well, or at least that's what they found, between having perfectionist concerns and your risk of injury. So I'll stop there and shoot it over to you, Kevin. What do you think about this paper?
Yeah, I thought this paper was interesting, the topic in general, but in some ways, I almost feel like they tried to make more out of their findings than they really were, because I don't know that I am necessarily going to take this article or findings from this article and do anything actionable from it. I thought that there was several limitations in just kind of its external validity. There's a few things within the methods of the paper that I thought that they maybe should have done differently that they didn't do. Specifically talking about, I would have liked to have seen individual data reported for training load as opposed to just group averages. And then even some of the methodological things like classifying injuries, I saw that a majority were traumatic. And I don't know if, even if you frame it from like an internal marker of loading, if personality type or in this case, perfectionistic tendencies really impact that all that much. So I'm kind of at a loss at what to make from their findings exactly.
And I'm trying to find it here, but the model, the regression model, so when you look at like these relationships, you try to look at how much variance in the outcome is our model representing. So, and it was about 11%. I'm trying to find the exact quote, but essentially their perfectionist injury model accounted for about 11% of the variance of injury, which means that at minimum 89% of other factors account for about 89% of why these athletes are getting injured in the first place. And those are factors that obviously weren't looked at or measured in this paper. So to your point, I think that they could have maybe highlighted that a little bit more. And I think that is something to take away. Like your point, what do I actually do with this? I think if we talk to the authors, they'd probably say, well, yeah, we highlighted a bunch of needed research in the limitations, but it certainly was, you could kind of tell in the introduction that they were definitely biased to the kind of the concept, which I think it's interesting. I do think it's interesting. But I'm not necessarily gonna give people the questionnaires that they used, as part of my intake forms just yet. I don't know if I'm going to be measuring for perfectionism at this point.
No, I agree. And like, that's kind of like, I can see how it has a role. And maybe if we're talking about just like adaptive capacity of the athlete, that's kind of like where I felt like they were coming from. If I was trying to, take this article and say, how can I use this or apply this, how that may have a negative or a positive impact on their ability to handle stress and training loads. That's as far as I got really with it, because I don't know what else understanding the personality type of that athlete is really going to impact in my day to day.
Or if we can change it.
Right.
I mean, I suppose, and that's not what they were looking at. So this is not an intervention study, obviously. I'm just wondering if there are things that we could pick up just anecdotally or kind of subjectively as we're monitoring, as we're interacting with the athlete over the course of time. If we pick up on things like them saying, what's going to happen if I miss this lift? What if like kind of dwelling on the negatives, and maybe if that becomes a pattern where you're seeing them like focus on the negative aspect, almost like a self-fulfilling prophecy, that type of thing. You can kind of pick up on that with certain people, but maybe you're trying to redirect that, but I'm not sure if it's like a direct intervention strategy, or if you're trying to measure that and change it, because I think some people are just a little bit more negative than others, like in general, and I'm not sure what capacity we have to change that. John has got something to say.
What's up, guys? How's everybody doing tonight?
Good,
Doing
man.
well, John. How are you?
Doing well. So this is a paper that I've kind of clung on to, especially as a powerlifting coach. And one of the biggest reasons, the limitations are pretty obvious. It's a prospective study. I'm with you, Kev. I would really like to see some more individual markers as opposed to like rolling averages and that sort of thing of the actual team. But anecdotally, the reason I find this so interesting is because that athlete with the perfectionist, I always slay this word, but the concern type behavior typically comes across as the difficult athlete. And one of the things that I've noticed is that they kind of fall into one of two different buckets. And this is where I would like to start to see this research to go. I like this study because it's scratching the surface on something that I think would be very interesting to study. I see athletes with perfectionism concerns doing one of two things. They're so worried about the minutia of the execution that they hold back the actual intensity that they're able to use, or they get to the intensity that's prescribed or whatever's in their program, and they fail over and over and over and over and over again. And an hour and a half long session in a barbell sport now turns into a 4 hour long session where they don't really complete a lift. They set up poor expectations for their future performances. And now we can start talking about mindset issues. On the other hand, I've also dealt with athletes who are considered easier to manage athletes who have that striving type of behavior, and they want the session to go well. They want better technique, more perfect technique, and they strive for that. But if they slip and fall or they have a bad session, it's one of they chalk it up as a loss and they keep on moving, or they find a way to get that win, which is something that was in the Mike Teixeira podcast that I've clung on to as well. It's just getting that little win. Again, there are limitations to this study that are pretty substantial, but I feel like at least going in this direction is kind of tipped off onto something that I've picked up on in my own athletes over the years, where that one person that starts choking that training and failing and getting a negative mindset, they get stuck in this trough of performance and they try to push too hard, and it's very difficult to manage their training load, and they get a negative expectation, and the next thing you know, they're complaining about, increased pain perception or an actual time loss injury or something like that. And now, granted, the population isn't correct for me to transfer that to barbell sport, and I'm just reading into this probably a little bit more than I should, but it at least tips my brain off to like, oh yeah, I've kind of been thinking that for a while. I wonder if that's really actually the case.
Well, we talk about training load being only one factor in the training injury paradigm. So we know that there's moderators and mediators. We always say that. Well, it's multifactorial, et cetera, et cetera, et cetera. But we never really dive into like what they are, because it's just like we don't know. And so if we take this at face value and say, well, it accounted for 11% of the variance of essentially the explanation of injury. If we take that at face value, which the sample is small for something like this, I think we need replication studies. So that's just as an aside. We'll assume that everybody kind of understands that this needs to be redone. But maybe personality traits are one of those moderators that can have either a positive or a negative effect on things. Then the question is, do we try to intervene on that in a focused way and an objective way to see if we gauge change? Because John, to your point, do you think that in the future you would potentially measure this type of thing overtly?
I mean, we go back to mood scores when we start talking about being able to actually measure